Time now for Restoring the Soul of Healthcare from the HELPcare Clinic in Austin.
It is that time as we are joined by our friends from the HELPcare Clinic, Dr. David Strobel and Lee Aase, and I almost felt like I should have brought a cake in today because we celebrate the first anniversary of the HELPcare Clinic.
Well, thank you for remembering.
That's kind of our topic for today, too, to kind of look back and see, from where it started. And I was actually reading your blog on the website that when the doors opened day one, it was pretty bare bones, and people were a little patient, and we slowly built it up.
Yeah, it really was quite a first day.
Yeah, and it was a year ago yesterday that we first opened the doors, and Dr. Dave didn't do the first appointments until the following Friday, so we've got another kind of anniversary coming up as well. Yep. But just during those first days, we were getting some of the, I wouldn't say last minute details because there were just a lot of things to be working out, but if you look at the picture on the blog, we had a pretty bare reception area. It was just a few chairs and the freshly painted walls, but over time, over the coming few months especially, we got a lot of feedback from our founding members. We got we added some team members that we obviously didn't have at first, like 6 nurses. So we had no nurses at the start. Lisa, my wife, was doing the vital signs, and she pretty quickly recognized that even though she had a year of nursing school, that this wasn't something that she should be doing, and that, Anyway, we got Pam Riley as our first nurse, and then followed by Kathy Grabaugh and Rebecca Gatzmeyer as the next 2, and then later on, as we added Stephanie Kimmis as our second provider, nurse practitioner, and we were seeing patients more days per week than we needed more nurses. But just really a big shout out and thanks to our founding members in particular, because a year ago right now, we didn't look like much. We had a nice vinyl hardwood floor, but it was clean and all, but we didn't have all the functionality that we had promised, and yet they believed in the promise and they believed in what this could be. And kind of what we're celebrating now is, as we look back, that it's pretty exciting to see how that has been rewarded.
Yeah, it really has been.
In a way, it's I don't want to say mind-blowing, but I sort of forget how really bare bones it was right out of the gate. I didn't realize, and I was reading on your blog, that for a time, people wanting a blood draw were really putting in some time to get that to happen before you were able to do it here locally.
Yeah, that's right. We had to ask people to go to the blood drawing site, the phlebotomy site up in the Twin Cities, because we didn't have the equipment or the personnel to be able to do that. And that was inconvenience. And when the first day we started seeing patients, we didn't even have a hardwired internet connection. We were using a cell phone and a hotspot, and it wasn't that we didn't plan ahead. It's just that there's stuff we were opening and things hadn't quite gotten done yet. So
yeah. Well, it comes out. So I obviously had never opened a clinic before. Dr. Strobel had worked in a clinic. I've worked in clinics, but you don't have a full appreciation necessarily of all the other details that go into it. And so they're just things. We had a lot of grace from our members who recognized that we were working it out. We were going to figure out what was needed exactly, and we've made it. We made it. We definitely have a 5.5 day a week, kind of service with multiple providers, including Elizabeth Hedlund, who we introduced you to last week, and it's her first day today, so we're just working on orientation stuff with her, and soon she'll be seeing patients too.
Yes.
It's amazing what you can do when you have a really great concept and a whole lot of faith and patience to get to where you are today.
Yeah, and I can't say enough for the folks that just believed in us right from the beginning. I mean, they're not just customers. They're my employer, and they have believed in the concept of what we're doing and continue to believe in it. We still are hearing back from some of those initial positive comments, and they're still saying the same thing. So it's you can't please everybody. That's the secret to misery, trying to please everybody. But you sure can build a product that meets a need that people perceive. And I think that Lee especially has just been a tremendous resource for that. You can't have a doctor build it. You got to have somebody that does other things.
Yeah, well, I just wanted to, a couple things to highlight. First of all, to some extent, the proof is in the pudding, because we're getting people renewing now. Like, they came in a year ago and they got an annual membership, and they're coming in with their checkbook again, and they're saying, "Hey, I want this to stay. I want to stay a member here," and it's incredibly high percentage of the people that are doing that. But the other thing I'd say is, as we were starting out, part of what helped people have faith in what we're doing is that they'd had experience with Dr. Dave as he was their physician a decade ago or 15 years ago, and so he had a good reputation in the community and had patients who had been missing him since he was practicing elsewhere, and we're really glad to have him back. And so that helped us get off to a good start, and that caused people to be a little more understanding, I think, too, as they're saying, yeah, we got to work out the details.
And Dr. Dave, you kind of really struck a chord with me when you just said something, because from the very beginning, we called this program Restoring the Soul of Healthcare, and you referred to your patients as really being your employers. And as healthcare has grown and ballooned and gotten to what it is, that is kind of that connection that's been lost, where you really treat not them as so much just a patient, but that there's really an investment there, because that is your employer.
Right. And it's a back and forth cooperative agreement. I always tell folks, it's my job to give you information. It's your job to be you. Mm-hmm. And if you don't have enough information, then my job isn't done, and you need to bug me. And we'll see if we can figure this out. And if I run out of ideas, then maybe I'll ask somebody that knows stuff more than I do, and we'll get you the information you need if we possibly can.
And really, that's the way
customer-based.
Yeah, and that's what you've evolved with, having more people in the office, that there are more ideas and more people that have maybe a more of a particular specialty, if you will, so that if you have something you're up against, you can go down the hall and ask a question or two and get the service that we need.
Right, and I can picture eventually a time when we have significantly different disciplines that work with us. I have a vision of that kind of thing happening, so that it would be not necessarily the same as a multi-specialty kind of clinic, but a multidisciplinary, different philosophies of medicine working together to accomplish what one discipline just simply can't do.
Man, that's what I absolutely love about this, is that we're 1 year in, and yet you continue to talk about a vision for the future and for bigger and better and providing service here in our community, and that's very commendable.
We're able to do that because of the support of the people that come here. It's just, I can't thank them enough.
Yep. Yeah, and so a couple of things. We just want to also thank KUS. We've really enjoyed doing this program. This has been a great way to kind of document what has happened, and it was kind of fun to look back. Last night I was putting this blog post together to be able to say, yeah, we talked about that on the radio that week. We talked about that, and it gave us some milestones along the way. And so I encourage people to check out the blog post on our website at HELPcare.health. It's the top story that's there right now, but it kind of tells what we've been through and the things that we've added, and so sort of what's available now. But definitely the continued interest and growth of people who are coming to become members just makes it possible to add more and more services, and we're just committed to do that. And then the final point that I want to make is, we did open HELPcare Clinic in Rochester. we just want people in Austin to know that Austin will never be second. Okay, Austin's always the first, and this is our hometown. We're committed to doing this for our hometown, and we always want to have the best of all the services be here. And so even as we're looking at potentially some other locations, we want to have people recognize that the commitment is to providing the great service here. We want to provide great service everywhere, but we won't allow ourselves to be distracted from providing the best care we can here in Austin.
Austin will always be the nucleus of this.
Yes.
Yep. Kind of like with the Hormel Company, that they got plants all over the place, but there's one flagship.
Absolutely. We're way out of time. I appreciate the conversation today. It has been my privilege to be able to talk with you and learn all about the various aspects of how this clinic is going to work, and it's been a fantastic journey. Lee, just real quick, again, if anybody wants more information, contact, what can they do?
Yeah, they can give us a call at 507-279-2345. Or stop by to see us at 308 4th Avenue Northwest. We're just a block east of St. Augustine's.
All right. Fantastic. Gentlemen, it's been a great year. We look forward to a fantastic future as well.
Thanks so very much, John. God's blessings to you.
Thank you very much. We'll talk to you next week.